Hey everyone, welcome back to the channel. Today's topic of conversation is hydronephrosis. Now this is a subject that is highly misunderstood and oftentimes leads to a significant amount of fear for people with regards to kidney damage. And today we're going to walk through all the different stages of hydronephrosis to give you a better perspective on what's happening at each stage and when you need to start getting concerned about potential kidney damage. Now, if you're looking for all this information in a written format, I encourage you to check out our education blog on our website. There's a link below in the description. Now, before we move forward, please smash that subscribe button. This helps us get in front of fellow kidney stone sufferers like you and I, gives them the information that they need in order to take charge of their kidney stones. Without further ado, let's dive in here. So, hydronephrosis is, in essence, it is a dilation, or basically it's an expansion of your kidney's collecting system, which is the internal part of your kidney. And this is due to a backup of urine caused by your kidney stone. And it leads to different things that are happening within the kidney that will define the different grade and severity of the hydronephrosis. So we're going to start off by talking about grade 1, which is also known as mild hydronephrosis. And one of the biggest things and misconceptions is most people walk out of the hospital or the ER and the doctor or urologist has told them that they have mild hydronephrosis, and there has been a fear of kidney damage that has been instilled in them. However, this is really inappropriate because with mild grades of hydronephrosis, even up to moderate grades, their risk for kidney damage is 0 to very, very low. And a mild grade of hydronephrosis is going to be present with pretty much any symptomatic kidney stone. And when we say symptomatic, meaning you've had some sort of a pain event and you are aware of your kidney stone, it is likely in either the renal pelvis or it's made its way into the ureter. Kidney stones that are still in the kidney are oftentimes asymptomatic and not causing any kind of problems, but they are present. So at a baseline, all kidney stones that are symptomatic are going to have mild hydronephrosis as a baseline. No need to be concerned here. Now, this backup is very, very slight. Now, it's really just kind of pulling up into the collecting system and causing a little bit of expansion, but it's very, very mild. And this is why it's really not much of a concern. And you're not feeling any pain, and the risk of damage to your kidney is 0. Moving on now to grade 2, which is also considered mild, we're starting to see a little bit more urine backup, and this backup really predominantly expands into the renal pelvis. So if you're imagining the kidney, the renal pelvis is like the river delta that's just about to flow into the ureter, which then makes its way down to the bladder, to the urethra, and out of your body. But this can expand quite significantly in the setting of grade 2 or mild hydronephrosis, and this is where most of that urine is going to be backing up. Now, still, there's no pain here. However, the difference is you're likely going to start to feel a slight pressure sensation on the kidney or the side of your body where that kidney is located that has the stone, or the stone in the ureter that is impacting that kidney. So you might feel a little slight pressure. It could come and go in waves, but you notice something is going on back there because urine is starting to back up. Still mild, not a problem, no need for concern, and the risk for kidney damage is 0. Now, moving on to grade 3, which is considered moderate hydronephrosis. This is a moderate backup of urine into the renal pelvis, and now it's starting to pool more so into the collecting system of the kidney, which is the actual kidney itself. The medulla, which is the internal piece of the kidney with all the little different calyces inside of it, the thickness here is actually going to start to reduce by about 30 to 50% because the urine is starting to back up and the different calyces are actually starting to disappear or dissipate to a certain degree because it's expanding to the point where that urine is taking up all those things and it's no longer individual calyces, it's just kind of morphing into one big solid vessel. Now, because of this thinning of the medulla, pain is going to start to become present here. And the pain is still moderate. We would like to put it at about a 5 out of 10. It's enough to get your attention, but it's not like a nuclear explosion type of pain like you might experience in grade 4. But you're aware of it, and it also can kind of come and go in waves just based upon your urine coming and going out of your urinary system. So moderate pain will be present here, and it can come and go in waves. Now, also notable, you're going to start to feel a more consistent pressure sensation because of all that urine that is starting to collect, not only in the renal pelvis as we had discussed in grade 2, but in the collecting system. And as you've watched our video on renal colic, we'll link a card up here for that, the renal colic pain starts to hit when the kidney starts to expand because of urine backing up into this. So we're starting to get our awareness here that there's something happening, and you're going to start to feel it more consistently than you would during grade 2 mild hydronephrosis. At this stage in grade 2, it might come and go, you feel it, you don't feel it, but here it's starting to become a little bit more consistent, and along with that pain, you're starting to recognize that there might be something brewing. And because of this, the risk elevates just a little bit. We're still at a very low risk of kidney damage, and it's still less than 10%. So even though you might have pain, you're starting to feel consistent pressure, the risk of damage to your kidney is still low. Now, coming into grade 4 hydronephrosis, this is where things start to change pretty significantly. Now, we're now talking about a severe backup of urine into the renal pelvis and into the kidney collecting system. So much so that that medulla that we had mentioned before, which is the interior of the kidney where all the calyces are located, it's pretty much gone. That's because the kidney has expanded to the point where those calyces have pretty much disappeared and they've just been filled with urine entirely. So no more individual pockets, it's just bloated up and full of urine. And because of that, we're going to start experiencing pain. But there's another thing that's happening as well. The cortex, which is the exterior portion of the kidney, this is also starting to thin as well. And this is where the real severe pain starts to pick up. Because now we're stretching the actual vessel itself. It's not the inside of the kidney, it's the exterior of the kidney. And this puts significant stress on the body, and you're going to get pain as a result of it. So that cortex is going to decrease by up to 50%. Typically, this is about 6 millimeters in thickness in a healthy adult. And when this kicks in, we're starting to get down into the 2 or 3 millimeter range, which is starting to get concerning. And again, as we talked about, pain is now spiking up considerably. Pain, typically we'll say it's probably 8 or 9 out of 10. 9 out of 10 is what we put here because typically a 9 out of 10 pain event typically is something that will get someone's attention. And if you've had a kidney stone, it's likely that you've experienced grade 4 hydronephrosis when you first realized you had a kidney stone. That initial huge monumental nuclear explosion type of pain event that typically sends people to the hospital or a trip in the ambulance, this is grade 4 hydronephrosis in action because it has caused such a severe backup of urine into your kidney that medulla is gone and the cortex of the kidney, which is the exterior of it, is stretched so thin that the kidney is just throbbing and all those nerve endings in there are screaming, which is what leads to renal colic pain. Now, one thing I want to note here is you can flow through all of these grades of hydronephrosis at any point in time. You might be cruising along for a couple weeks, all good, not feeling any pain, maybe a little bit of pressure, and then all of a sudden you get a huge spike of pain. This can come and go. This is completely normal. It's not uncommon for your kidney stone to be moving through your ureter and then all of a sudden it gets lodged in a goofy position and it causes a backup of urine that's more severe than it was before. Or if you're not properly hydrating, this can become more consistent. Thus, increasing your hydration and staying consistently hydrated is exceptionally important if you want to avoid grade 4 hydronephrosis for any period of time. But just know, just because you spike up into a severe portion of hydronephrosis, it doesn't mean that you're at risk for kidney damage. It's the prolonged version of the grade 4 hydronephrosis is where we really need to be concerned. So we do note here that that constant pressure sensation is going to be present through pretty much all the time that you're feeling with this, and the risk does start to become high here. But again, I want to make a notation. If you experience this temporarily, you get a little spike up of pain, it doesn't mean that you're experiencing grade 4 hydronephrosis in perpetuity. You may have just experienced a spike, and it might downgrade itself to grade 3 or grade 2 or grade 1. It's all going to be dependent upon where that stone is in the system and what kind of blockage it is causing. And if you're finding yourself where you're in this position where the pain is lasting for more than an hour, you can jump, you can stomp, you can move around, you can go for a run, you can do something physically active to try to get that stone to move itself, to clear yourself of this grade 4 hydronephrosis. However, if you have this lasting for longer than 6 hours and you're not able to rectify this on your own through the physical activity or jumping around, stomping around, trying to get it to physically move, it's time to seek medical attention. Because this time, at this point in time, if it's longer than 6 hours, now we're starting to risk potential permanent kidney damage. So it's not an emergency. You have some time. It's not going to completely damage your kidney. Typically, though, you're wanting to seek care within 24 to 48 hours. The sooner the better, though, because again, as time persists, damages can continue, but fortunately, again, more often than not, you're able to rectify this yourself through movement, but if you're not, it's time to seek medical attention. Now, before we sign off, just want to finish with one last thing. We did put together a handy little PDF guide for this as well, because a lot of this information can be confusing and it's going to have visuals as well. So it will give you a visual perspective, like we've seen in this video today, of what's happening at each different grade of hydronephrosis, and it will also tell you when it's time to go seek treatment. So this is a very, very handy thing to have on hand, especially if you've been instilled with fear from your urologist with regards to kidney damage. Again, we're only really looking at kidney damage when it comes to grade 4 level that is prolonged for longer than 6 hours. Outside of that, it's going to be present with your kidney stone pretty much until the time that you pass it, and it will come and go in waves and recede back again. It is a fluid, no pun intended, situation with regards to hydronephrosis. So it's not something that needs to be feared. It needs to be monitored, but it doesn't need to be feared because the only instance of real severe kidney damage is down here. And if this is happening for any period of time, you're going to know about it, and you're going to be so uncomfortable that you're not going to want it to last for any longer than it has to, and you're likely going to seek the medical attention that you need in order to relieve this pressure. So in order to get this guide, please head on over to stone-relief.com/pages/hydronephrosis and download your copy of our free PDF guide. Thank you all so much for stopping by. Please don't forget to smash that subscribe button, and please leave any comments or questions below. We do answer all of them, and we will see you again in the next video. Thank you, everyone.